Good morning, everyone. It is Health Wednesday,
Health Wednesday.
and I'm with the amazing, just look at her, incredible, beautiful Yvette.
Very sweet. Thank you.
Oh, thank you. So, today we're going to be talking about a topic that both of us are very much into, and we want to educate you on it if you don't know much about it. So, how many of you have gone to the doctor and you go and you sit down with the doctor? First, you're sitting in the waiting room, in the waiting area for the doctor to come. You're sitting there, sitting there, sitting there. Finally, you hear something outside the door. He opens the door, he comes, he sits with you, and he's there with you for literally 8 minutes. He prescribes you a medication and then goes out and goes to his next patient. So that's traditional medical doctors. But what we want to talk about today is something called a functional doctor. And if you've never heard of what a functional doctor is, what they do is they look at the root cause. So you walk into the doctor, you maybe have heart disease, cancer, something like that. Rather than just treating with medication, they look to the underlying issue. They look to see what you're eating. They look to see if you have inflammation in your body. They look to see how much sleep you're getting. They look at all kinds of things. And well, why don't you tell everyone, like,
Well,
kind of what if you go to a doctor's visit, like, what is it like,
well,
the
I got to
difference?
tell you that visiting a functional doctor after, years and years of frustration with specialists and giving medication and still not feeling better. I did cure myself of IBS, even though specialists will not believe that it was called. Cured myself with food, but I did. But now what I couldn't cure was my Hashimoto's, which is a thyroid disorder. I've been on medication for a long time. So I visited this functional medicine doctor. She was amazing from sitting even in the waiting area. Her girl came out, she was talking to me, and when I went in to see her, it was an hour of her just listening. She was listening to me. They have to take an extent health history.
Yeah, so let's talk about that for a second. So you go in, you sit down with the doctor, and now what they're really doing is they're really getting a real extensive history to try to figure out what's going on inside, right?
Well, actually, yeah. And then what we were doing together, and it's amazing because she was just letting me go because I'm thinking, okay, well, and we were piecing the pieces of the puzzle together, and she was showing me how, okay, yep, you're right about this, and we just figure it out. Okay, the thyroid issue was caused by my leaky gut from when I was 7. But I didn't leave there. I did not leave there with a prescription for medicine, because what they want to do is cure look at the whole entire body. They look at what you eat, your lifestyle. So what they want to do is a total change.
So let's talk about, here's an example that you guys can use. So we have someone that we know that was just diagnosed with cancer for a second time. And she's very young. She's younger than I am. And she was treated with all the regular cancer drugs. She got the chemotherapy, the radiation, and what that is, that's toxic, right? So it essentially goes in the body and it kills all the cells. It kills everything. The problem with that is, if you don't treat the root cause, what's causing the cancer to grow in the first place? If you don't treat that, the problem is it's going to grow right back. And that's exactly what happened with her. So now she's literally wanting to look at it from a more functional approach. So here are some resources that you can have. If you're interested in finding a doctor, and these are, by the way, a functional doctor.
They have more medical training. They went to medical school,
right,
and then they got their license to become a functional doctor.
Right. So when you hear the word functional doctor, it's not just some random guy who's just said, "Hey, I'm going to practice." It's someone that went to medical school, but then got additional training to figure out, well, you're sick, but why are you sick? What's
causing? And they
causing?
have a tremendous amount of training in nutrition, because you have to understand that a regular doctor has about 6 hours, I think, in total in medical school of training in nutrition.
Correct.
So when you ask them, because I have, especially with my thyroid, what should I eat?
I
What
don't
shouldn't
even
I
think
eat?
it's 6 hours, by the way.
It might be less
Yeah,
than
yeah.
6. Well, it's alarming because what I learned from doing my own research, I couldn't believe that I went to a specialist and he didn't tell me with a thyroid disorder, stay away from sugar, stay away from gluten. I was never told that.
So let's put this into real simple terms so that you can get this. Listen, Yvette went to a doctor. The doctor was ready to cut out part of her intestine.
Yeah.
Right? They were going to cut out part of her intestine to help her with her IBS.
Well, they thought I had Crohn's disease.
Crohn's, that's what they labeled it.
Yeah.
But again, when she got to the root cause, what was causing the inflammation, what was causing her to have all the symptoms, it was what she was eating. When she changed what she was eating after how many years?
Oh, gosh.
30 plus.
Yeah.
30,
easily
30 plus years. Guess what happened? It went away. They were going to cut out her intestine, part of it, and now she has her intestine, thank God.
Thank goodness.
But she's healed. So that's why we're so passionate about functional medicine and functional doctors, real medical doctors that get to the root cause of yours. So we posted here in the not in the comments, but in the post itself, there's a couple links. One link is you can do a search for a functional doctor in your area, wherever you live. And then you can go and see the functional doctor and see what the difference is. I think once you go to a functional doctor, the doctor that's going to look at the root cause, you'll never want to,
Because the thing is, too, that people are not used to being heard.
Yeah.
Your regular GP, I mean, listen, it's not their fault. It's what the insurance company will pay for. They're busy. They're trying to see many patients. Here, they will listen to you.
100%.
Yeah.
I mean, think about it. A doctor is going to spend an hour with you to help figure out what's going on inside, And again, like Yvette said, it's not the other doctor's fault.
No.
They have to see a lot of people because they're billing to the insurance company. So it's very different.
And
approach.
with that, the woman that I did see in New York, she did accept insurance. You have to look a lot of these, because it's very new right now. Insurance companies are starting to cover it.
Yeah.
But look, because you can find a functional doctor that will take insurance.
Right. So then one other thing we put in the post is Dr. Mark Hyman. Dr. Mark Hyman works at the Cleveland Clinic, and he's like one of the founders of functional medicine.
Not the founder, but he's up there.
He's really high up.
He's up there. Let me tell you, I'm always looking at reading his books, listening to his podcast. He has an amazing podcast, The Doctor's Pharmacy, every week. Very informative about food. It's not just about medicine. It's about just overall health. Because remember, it's not only the food, it's our lifestyle.
Right. Absolutely.
It's really our lifestyle. Are we meditating? Because once I fixed all that, everything fell into place.
Absolutely. So bottom line today is if you've been to the doctor and you've been trying to figure out the root cause of what's actually going on, and they keep giving you different medicines and nothing's really fixing the problem, a functional doctor, a doctor that's going to look to the root cause and see why are you having stomach issues? Why are you feeling a certain way? What is the reason for it? Not just, hey, I'm going to take this medicine and I'm going to give it to you and you're going to take it and it's going to get rid of the symptoms temporarily.
Yeah.
They go to the root cause and they fix the issue. So again, we have a couple links here for you. If you have any questions for us, comment below and we'll answer. But we really, both of us have used a functional approach. Me, when I was little with, they would have medicated me for ADD. Instead, a functional doctor took me off of sugar and artificial sweeteners, and then I was able to focus. Amazing, right? They treated the root cause. So that's why we're passionate. Any last
But it's funny
think?
Because even children nowadays, I hear more and more parents say that they're on these medications. And when I do say, well, not being nosy, but I will recommend, they don't want to hear that because a doctor said the medication.
Right.
So it's about educating yourself. Not that I'm saying that a regular doctor, they're bad. I'm not saying that. I'm saying that if you exhausted all your avenues and you've gone to so many specialists and nothing has worked,
Try.
Try it.
Yeah,
Try it.
and I would honestly, you can use as a family physician a functional doctor.
Yeah.
He's a medical doctor, but you'll see the difference when he approaches you, when he approaches your children, when he approaches your family. They care. They care in a sense that they're looking to see what's causing you to feel the way you're feeling, and they're looking at fixing that, not just covering it up with medication
Yeah.
and covering up the symptoms. So that's it. We're passionate about this. That's why we went a little longer today. Any
Yeah.
closing comments?
No, I mean, just check out the resources. I mean, he has so many videos where he's, talking about food and just lifestyle and his own health journey. How Dr. Hyman started this all really short. 15 years ago, he was sick.
Yeah.
This is a doctor now. All the top specialists seeing him, and they all gave him medication. So this is how he became passionate about this and built his own wellness clinic up in Massachusetts. It's because
Yeah,
of the
he
discovery.
was sick.
He was
and
very
and
sick.
he went to all the doctors, and they were trying to treat him the traditional way, and nothing was fixing it.
10 different kinds of medication, I believe, or more.
And he said, "That's it. It's just enough. It's enough."
Oh, and then another one we should actually look up. I forgot. I got really excited. He has a documentary, Broken Brain. I think it's a 6-part series.
Oh, yeah.
That was absolutely amazing.
Yeah, that was great. We watched that. That was really good.
Yeah.
One last thing here. I was just thinking as we were talking. Bill Clinton had issues with his heart, and he reversed heart disease. With a functional doctor. I think he worked with Dr. Esselstyn and I think Mark Hyman both doctors, but they took a different approach with him, and now all he does is talk about the advantages of functional medicine. So that's it for today. We went a little long, but that's because we're passionate. There's a link in here that you can click on. You can search doctors in your area that take a functional approach, that are medical doctors that will help you. And we hope it helps. Comment below. Let us know your thoughts, and we will talk to you
tomorrow.
Tomorrow is Thursday.
Thursday.
See you tomorrow.